Hazel Cheeseman is from the anti-smoking group Action on Smoking and Health, and Tom Edwards is from Neo e-cigarettes. What do you think, Tom?
The WHO has come out with the news that they'd like to ban electronic cigarettes in public places, in closed spaces. I completely disagree. I think what we have with electronic cigarettes is an opportunity to provide smokers with an alternative form of ingesting nicotine, which isn't as harmful because it doesn't contain the tar, it doesn't contain the carbon monoxide. I think every opportunity we can give smokers to use an electronic cigarette as opposed to a tobacco cigarette is beneficial. And if we force them outside, we only ostracise them further.
Only ostracise them. But you know, some former smokers say, well, that was the boost up the backside they needed to potentially give up. But I guess the point here is it's not to do with smokers, it's to do with non-smokers and what kind of effect it might have on them. Hazel, has there been enough research done on what passive e-smoking can do to the rest of us?
There's been a reasonable amount of research done, but we definitely need more. There's a lot of products on the market. Not all of them could possibly have been tested. There's so many of them. But what we do know about the products that have been tested is that they are much safer for people than secondhand smoke, and that there isn't necessarily a reason to be concerned. If somebody's vaping next to you, it's not the same risk as somebody smoking next to you. So, you know, in many ways, I would probably agree with Tom.
So you think the WHO is going too far?
I think the WHO may have gone a little bit too far on the point of banning electronic cigarette use in public places. I don't think that the evidence supports that at the moment. If you look at the evidence that we have for banning smoking in public places, that's very comprehensive. It's very bad for bystanders, and we just don't have the same quality of evidence for electronic cigarettes.
The other thing the World Health Organization is concerned about is e-cigarettes and children. Again, is there enough regulation there protecting our youngsters from these things?
I think what we've seen is a market that's gone from 700,000 users in 2012 to over 2 million users today. You know, this market is growing really rapidly. The way the products are being marketed is growing really quickly, and we do need to think about how we regulate these products so that we ensure that they're not attractive to children.
But they are attractive all the same, aren't they, Tom? And, you know, with the number of smokers going down, you want people to keep using your product, no doubt. And yours is, you showed it me before we came on air, it lights up blue at the end. It's a sleek black object. It's not unattractive, is it, to smokers or non-smokers?
Well, I can completely agree with Hazel that sort of regulation should be proportional. I don't think any electronic cigarette company or reputable electronic cigarette company would say that they don't want regulation. We don't market towards children. We want to have guidelines to be able to tell all of us what we can and can't do in marketing so that we can do it responsibly.
Do they really need to light up, though? Do they really need to look so sort of alluring?
Well, what we found from our own consumer testing is that people prefer, for whatever reason, to have the light at the end. Neo, for example, we don't light up red like a cigarette. It doesn't look like a cigarette. Like you said, it's a little more sleek and stylish than a burning ash in your hand. But we don't aim to imitate a cigarette. It's not a cigarette. And I think that's the point we're trying to make. It's an electronic cigarette which doesn't contain tar, doesn't contain carbon monoxide.
Okay.
It has the nicotine, which is addictive, but it's not harmful. And it's a realistic alternative for ingesting nicotine for people who are addicted to smoking.